Hello, dear ones. This is Dr. Emily Carter, and today we're going to talk about something that might be happening inside your brain right now, without you even realizing it. That sleeping pill you've been taking for years might be silently stealing your most precious memories. Frightening, isn't it? Recent research reveals an alarming connection between common everyday medications and a 54% increase in the risk of developing Alzheimer's in people over 65. Have you ever stopped to think about what medications you're regularly taking? If you or someone you love is in their senior years and uses medications for sleep, anxiety, allergies, or stomach problems, the information I'm about to share today could literally save your brain health in the coming years. First of all, I want you to understand what really happens in your brain when you take certain medications. Our brain depends on a delicate balance of neurotransmitters to function correctly. Among them is one called acetylcholine, which plays a crucial role in memory formation and cognition. It's like the messenger that carries information from one neuron to another, allowing you to remember your grandchild's birthday or where you left your car keys. The problem is that certain medications have what we call anticholinergic activity. They block or reduce the action of acetylcholine in the brain. Imagine this as if someone were cutting the communication wires between your brain cells. At first, you barely notice it. Maybe you forget a name here or there, an occasional appointment. But when this happens repeatedly for months or years, the neural connections weaken and the brain gradually loses its ability to form new memories. Prolonged use of these medications creates a brain environment that favors the accumulation of beta amyloid and tau protein, which are precisely the biological markers of Alzheimer. It's as if these medicines were preparing the ground for the development of the disease. And the most alarming part, many of us are taking these medications every day, having no idea of the risk we're running. Let me share with you the story of Clara, a 72-year-old retired teacher I recently treated. Clara began to notice she was forgetting the names of cherished students, those who had made an impact on her life during decades of teaching. She also began losing objects around the house with increasing frequency. During a routine consultation, I reviewed her medication and was alarmed. For more than 5 years, she had been taking diphenhydramine to sleep and an antacid for reflux, both with strong anticholinergic effects. I thought I was starting to develop Alzheimer's like my mother, Clara told me with tears in her eyes. Her mother had suffered from the disease for years, and Clara was terrified by the idea of following the same path. But 3 months after we switched these medications for safer alternatives, Clara began to feel more alert. Her memories gradually returned, and that constant sensation of mental confusion significantly decreased. Can you imagine the relief she felt? It's like recovering part of your identity that was slowly disappearing. Now let me talk about the main villains of this story. Studies conducted by the University of Washington and published in JAMA Internal Medicine identified 4 classes of medications strongly associated with the development of dementia when used regularly for more than 3 months in elderly people. The first group includes anti-allergics and sleep medications containing diphenhydramine. They're present in medicines such as Benadryl, Dramamine, and various over-the-counter sleep medications, those you buy at the pharmacy without a prescription. Many elderly people have no idea that these seemingly harmless medications have a potent anticholinergic effect. It's like a Trojan horse that enters your body disguised as help for sleep but is actually compromising your memory. Have you ever had that feeling of waking up groggy after taking a sleeping pill? That's not just the residual effect of sleep. It's your brain fighting against the blockage of neurotransmitters essential for memory. When this is repeated night after night, month after month, the damage can become permanent. In a study with over 3,500 elderly people followed for 7 years, those who regularly used these medications showed cognitive decline equivalent to 3 additional years of brain aging. It's like artificially aging your brain. The second problematic group of medications are tricyclic antidepressants such as amitriptyline and doxepin, which are still frequently prescribed for chronic pain and insomnia. The cognitive impact can appear even at low doses when used for long periods. I have patients who have been taking these medications for decades since they were prescribed for a temporary depression crisis, and they never stopped, nor did their doctors ever suggest a reevaluation. Maria, a 68-year-old patient, had been taking amitriptyline for 15 years for back pain. When we gradually weaned her off this medication and implemented other forms of pain control, she told me something impressive. "Doctor, it's as if a fog had lifted from my mind. I didn't even realize I was living with this constant mental confusion. Can you imagine living for years with a cognitive deficit and not even notice it because it set in so slowly that it became your new normal?" The third group includes anticholinergics for the bladder, such as oxybutynin and tolterodine, used for urinary incontinence. These are among the medications with the highest risk for the brain. The problem is that many patients take them daily for years, fearing the embarrassment of urinary leakage. Research shows that these medications can reduce cerebral blood flow by up to 29% in crucial regions for memory. That's a very high price to pay for bladder control, don't you think? Lastly, we have antacids and antispasmodics. Certain medications for reflux and intestinal spasms contain scopolamine or similar compounds that cross the blood-brain barrier, the brain's natural protection, and subtly affect cognition. The danger here is that the problems appear so gradually that by the time you realize something is wrong, the damage may already be significant. Charles, a 75-year-old lawyer, had been taking an antispasmodic for irritable bowel syndrome for almost a decade. He came to my office complaining of difficulty remembering client names and case details, essential skills for his profession. After replacing his medication and implementing complementary techniques to control his intestinal symptoms, he recovered much of his mental agility in just 4 months. "If I had known what this medicine was doing to my brain, I would never have continued for so long," he confessed to me. But it's not all bad news. The good news is that there are alternatives for each of these medications, and often the switch can mean a significant improvement in brain health in just a few months. Let's talk about these safer alternatives for your brain. For insomnia, instead of traditional medications with diphenhydramine, we can use sleep hygiene techniques, melatonin, and, when really necessary, medications like trazodone, which have less cognitive impact. Small changes in nighttime habits, such as avoiding screens 2 hours before bedtime, keeping the room completely dark, and establishing a regular routine, can resolve up to 70% of insomnia cases without any medication. For allergies, second-generation antihistamines like cetirizine or loratadine are much less harmful to the brain than the older ones. They have a molecular structure that makes it difficult for them to cross the blood-brain barrier, thus protecting your cognitive functions while still controlling allergy symptoms. If you suffer from overactive bladder, know that there are alternatives such as pelvic floor strengthening exercises and medications like mirabegron, which don't affect cognition. A 2022 study showed that women who did pelvic exercises regularly for 12 weeks had a 65% reduction in incontinence episodes without any cognitive side effects. And for digestive problems, proton pump inhibitors in controlled doses or alternatives like famotidine present a lower cognitive risk than the old anticholinergics. Additionally, changes in diet and lifestyle can drastically reduce the need for continuous medication for reflux. Dr. Mark Silva, a neurologist specializing in dementia who works with me, always says something I find profoundly true. We regularly see patients diagnosed with mild dementia who show significant improvement after discontinuing these medications. In some cases, the cognitive symptoms reverse almost completely when the intervention is done in the early stages. This is corroborated by science. In a 2023 study, 68% of patients who substituted anticholinergic medications with safer alternatives showed measurable improvement in cognitive functions in just 3 months. Can you imagine the impact of this? People who thought they were developing an irreversible neurodegenerative disease, discovering that they were actually suffering the side effects of medications that could be replaced. So, what should you do with this information? Based on the most recent evidence from neuroscience, I want to make it very clear. Never, ever stop medications abruptly or without proper medical supervision. This can be dangerous and cause severe withdrawal effects. The first step is to do a complete review with your trusted doctor, bringing all the medications you use, including over-the-counter ones, those miracle teas, and supplements. For every risky medication, there is a safer alternative for your brain. The difference between continuing with a strong anticholinergic or switching to a safer option could mean extra years of mental clarity and independence. We're talking about quality of life, about being able to continue recognizing your grandchildren's faces in the future, about maintaining your autonomy for as long as possible. Think about this. Your brain is the result of decades of learning, experiences, and memories. It's what makes you who you are. Doesn't it deserve to be protected with the same care you dedicate to your heart or any other organ? You take care of your blood pressure, your cholesterol, but how many times have you talked with your doctor about the health of your brain? Your brain deserves this protection. And the next time we meet here, I'll reveal how certain foods can enhance the protective effect of these changes, creating the perfect environment for brain health after 60. If you know someone who might be at risk, perhaps your parents, an older uncle or aunt, or even yourself, please share this video. It may be the most important gift you'll give to someone you love. Information is power, especially when we're talking about health. And don't forget to leave in the comments, do you or someone close to you use any of these medications I mentioned today? Have you already noticed any changes in memory or cognition? Your experience can help other people in our community. If you like this information, leave your like, share it with those who need it, and subscribe to the channel for more content that can transform your health and quality of life. Here, we care not just about symptoms, but about the person as a whole. Until the next video, this is Dr. Emily Carter, reminding you that taking care of your brain health today ensures your most precious memories tomorrow.